historic day. And the reason that we can do this is because of friends like Clare Waismann. She is the president and founder of the WAISMANN Method. They are fantastic. If you have someone who is suffering with opioid addiction, and this is something that can happen to someone on the street or in the corner office, you definitely want to check in with the WAISMANN Method and Clare Waismann. Thanks for being with us on a really important day here on the program. Clare, good morning to you.
Good morning, Jennifer. Thank you for having me in this, so important day that, that we remember how we once united as a nation, to protect our citizens.
We really do. We were united at that point. Now, here in California, we aren't feeling that we're so united at the moment. In the country, we aren't feeling so united at the moment. Just for you personally, Clare, before we talk about the WAISMANN Method and the recall of Gavin Newsom, what was 9/11 like for you? How did what made that experience stick out for you?
I was with my family. We felt so vulnerable that day and, afraid. But on the days to follow, we were in the streets. We had candles in our hands, and we felt like one. We felt like the well-being of our citizens came first.
And that was what we all stood for, right? We all stood out there together, and it felt like the right thing to do. Let's shift a little bit to some of the news stories this week. Grant, we've been talking about this off the air and on. There have been some pretty significant overdoses of celebrities in the news, and it all seems to be leading back to people who are taking drugs. Those drugs are laced with fentanyl. Can you speak, Clare, about this current onslaught? We're hearing all about this, and it's not even overdoses. These are poisonings, really, from fentanyl, right?
Correct. So, as sad as it is that, the people, those celebrities died, this is going on this year. Fentanyl is invading every corner of our society. It's coming through the borders in rates that are unimaginable. And people are overdosing left and right. Sadly enough, we don't have current data. Data usually shows up a year to 2 years, after the fact. And I think when we look at the data of fatal overdoses in 2021, it's going to be something horrific, a tragedy that we have not seen in our lifetimes. And I speak to patients all day long. And nowadays, they talk to me about friends that overdose like a mundane fact. I had 2 that overdosed. I had 3 that overdosed. I have never heard this in my life, and I've been doing what I do for the last 25 years.
And what you do, Clare, is help people get over their addiction through an amazing system of basically.
What we do is a medical detox in the hospital. Instead of allowing a patient to go through the withdrawal, vomiting, diarrhea for days or weeks on end, where most of them don't even make it through it because the suffering is too much. We put them in a full-service accredited hospital and get them through the withdrawal under medical care.
Clare, so when you talk about fentanyl and when they lace so many things with fentanyl, does that system work to get the fentanyl out of the system as well? Is it just eating the heroin and then the fentanyl dissipates on its own?
All opioids. Regardless of what they are. Fentanyl is, this is not the normal fentanyl that we use, in medical procedures. This is illicit fentanyl coming from China and Mexico that the potency of this drug is beyond anything we've ever seen before. And so as the withdrawals. Wow. So, having the patients in the hospital while controlling their vitals and getting them through the withdrawal, not just safely, but much more comfortably, allows them, to be emotionally present to deal with whatever emotional issues they have,
because
post-detox.
The physical ailments are so strong. Many people are terrified to get off of them, even if they want to get off of opiates.
Correct.
So this is
and the opiate patient, Jennifer, is different. than it was 20 years ago. We treat 72, 74.
A lot of people, exactly. So I said it could be someone from the street to the corner office, because this is somebody that may have had back surgery and gets hooked on painkillers and then finds himself with this addiction, and they're scared to get off. If you know some of those people, if you are that person, if the person is in your family, check out Clare Waismann, the Waismann Method, and it's the place to go. www.opiates.com, www.opiates.com. The Waismann Method is where you want to go. Opiates.com, 310-205-0808. That's 310-205-0808. Clare, thank you so much. Clare Waismann has been with us. And again, thank you for being with us, Clare. This is really important.